Hi, my name is Sydney Bennett with Tech Systems. I'm here today with Will Landry and Chris Newsom from FMOL. Will is the Senior Vice President and CIO, and Chris is the Senior Director of Infrastructure and Operations. I am representing the Louisiana HIMSS Board, where I'm the membership chair. So thanks for joining us today, guys.
Absolutely.
Sure.
Glad to be here.
Happy to be.
All right, we're going to start off with a few friendly softball questions. So, Will, does it bother you that Chris has an Android phone?
No, actually, it leads to a lot of very interesting and productive technology conversations. So we get to compare a lot of that. So while I have an Apple phone, I'm probably much more of a Microsoft products proponent.
He would have a Zoom. They still might.
I've had a Windows phone.
Have you really?
I did have. I think I had like the last series of Windows
Wow.
phones. Yeah, it was painful.
That
It got
tracks.
painful at the end.
That tracks.
What's y'all's favorite hot sauce?
Tabasco.
I use Louisiana hot sauce, just one drop, but I really like Evangeline hot sauce, but you can't hardly find it
Just one drop of that as well?
Yeah.
Okay,
for sure.
that's all you need.
That's right.
All right. LSU baseball or LSU football?
LSU basketball.
Baseball,
Okay. All right.
for sure.
Mardi Gras parade or St. Patrick's Day parade?
Neither.
Mardi Gras parade.
Not a parade guy.
No,
Not even in your younger days.
no,
Never.
never.
Never been to a parade?
No, I've been. That's how I know I don't like them.
You ever been to a parade in New Orleans?
Yes. Yes, I have.
Okay. So New Orleans parade or Baton Rouge parade?
Baton Rouge.
Oh, the Bronx parade.
Yeah.
The Landry family likes a parade.
We do not.
We like a parade.
Oh, you know
We
what?
like to carry
Disney
home all the
parades.
stuff.
I could do Disney parades, right? All Disney World parades.
Okay.
Those are legit.
That's something. All right. What's your favorite restaurant in Baton Rouge?
Mike Anderson's.
Lemmings.
You guys won't like my answer.
What
What is it?
Nukes.
What?
We don't have one in New Orleans.
Pretty sure it's like based out of Jackson, isn't it?
It's
Somewhere
a
in
chain,
Alabama?
yes, absolutely, but there's none in New Orleans. So when I come to Baton Rouge, I'll like,
Awesome.
get me a little nukes.
Are you a
Um,
sandwich eater?
I like a sandwich, yeah.
Mm.
Their chicken salad's really good. Nukes Q, you ever had the Nukes Q? It's also the best chocolate cake I've ever had in my life at Nukes.
I haven't been to Newsom in a while, but I do frequent Jimmy John's at least twice a week.
Yeah.
Maybe once, twice a week.
Does Newt have a local eye?
What's your biggest pet peeve about Will?
It's actually one of his greatest qualities too, is how contrary he is. It works in my favor a lot, but it doesn't work in my favor a lot. So yesterday we were setting up a conference and he was, all hot and bothered with all sorts of stuff. I'm like, Brad, you got to settle down. It's gonna be all right. So, but it was fun and we got it all straightened out. It was working well, but his contrariness for sure is one of my biggest pet peeves. But again, it works in my favor.
How's it work in your favor?
Because I can control what he's gonna say. 'Cause
Yes.
I know what he's gonna be contrary about.
Okay.
So
okay,
I can pitch a certain angle to get the angle I really want.
Okay, all right.
So
Yeah, he'll come in hot on something knowing that I'm gonna go. the other way. Or that I'm gonna say
Just to
something.
get you riled up.
Or to get the decision that I want, right? I
Right.
could completely believe it's a total garbage what I'm pitching. But
Uh-huh.
he's gonna be like, no, we should do it this way. I'm like, you're
You would
right,
think,
we should.
you'd
And now I
think
want
at a
him.
certain point you would see right through that.
Sometimes.
That's why you gotta get all emotional and get all hot and bothered by it.
Yeah, all right. All right, you guys ready to jump to some serious questions that the
Yes.
people really want to know?
Yes,
do it.
absolutely.
All right, so Will, you've been CIO for how long now?
A year and a week.
Okay, so what has been your biggest accomplishment here at FMOL so far?
I think I'll give you two things. One is our expansion of Community Connect and how well we've done it with our Epic Community Connect program and the responses that we've gotten from our customers. And just the team, how we've done it. And I think it's really been fantastic. The other is we are, and this isn't done, but we're in the process of doing it, is transforming our team from implementation focus to continuous optimization focus and looking at our technology. We've been so heavily focused on implementations for the last 10 years with Epic and Oracle and all of our other systems. And now we've got to get more, we've got to focus internally on those investments and build better products and focus on improving the experience for our end users.
So what are some of those investments that you're focused on?
Well, really, like I said, I know we're going to get to it in some of the questions, but looking at the new generative AI technologies that come with those, obviously, like working on improving workflows, reducing clicks. We've all talked about that, but not just reducing clicks for providers, reducing clicks for everybody, reducing clicks for their nursing team, for our back office staff, making technology simpler to work with. Versus, in healthcare IT, we have implemented very complicated systems over the last 15 years since the Affordable Care Act kind of changed everything with that. But I think there's a lot of opportunity to continue to simplify what we have in our environments.
Okay. Chris, what do you foresee as some of the upcoming IT challenges over the next year to two?
Just for FMOL or overall?
For FMOL.
Well, we're doing a lot of re-architecture to add resiliency to our infrastructure, and that's going to be very challenging and disruptive for everyone. How do you manage it? How do you make sure that it never goes down? And we have the automated processes to add that resiliency that we anticipate. There's going to be a lot of upskilling involved, which is a challenge in itself with team members, just because it takes time to learn new things. So that reinvestment in our team is really important to Will and I both, and in trying to strategize the next iteration of what FMOLIS is, and which is leveraging generative AI, cloud-based technologies, things like that.
So when you say it's going to be challenging for everyone, you mean your IT team or everyone in the organization?
Mostly for our IT team, but I'm sure that generative AI is going to spread like wildfire, and everybody's going to want to learn a little bit about it. So it's going to be challenging to operations if we start to manipulate some of their workflows and things like that with the Epic teams that other people kind of drive those innovation workflows forward. So it's going to be exciting. It's going to be fun.
Yeah. So speaking of generative AI, Will, I know you've talked a lot about how you are on, and I think even maybe lead an AI committee here at FMOL. What are some of the major goals and initiatives for that committee?
Yeah, we do. We have an AI focus group. It's myself, a couple of other senior executives, and mostly a group of our physician leaders across the health system. Our focus is really about looking at incoming products or opportunities within our existing vendors, and figuring out ways that we can implement it to augment our staff, right? We're not looking to replace anything. We're not looking for it to make clinical decisions. In fact, we already know that the generative AI is not good at clinical decision making, just based on other research that's been out there, research that we've done with LSU and some others. But it is very good at repetitive tasks. It is very good at content generation based on information that is already publicly available, right? And so we want to be able to, where we're focused is like quick wins and repetitive tasks that can help our team members get to do what they're doing, like to have them spend more time on what they're best at, which is caring for our patients and caring for our community. So that's where like our heavy focus is. We are also we look for quick wins. We're looking for short-term investments when it comes to AI. Specifically, we're not looking for any 36 or 60 month, those are off the table for us. We know that the environment is changing so rapidly that we need to be able to see 120-day pilots, or what value can we see in 90 to 120 days in small scope areas, because we know that the environment will radically change another 24 to 36 months from now. And we just have to be prepared for those types of changes. So that's why we're doing it kind of in smaller chunks to be ready to make those iterative changes.
How are you controlling, because all of your end users are out there, they have access to all sorts of formats of AI at this point. How are you controlling what they have access to and what they're using and the work environment and all the governance around that?
Our goal there, or our strategy there, is we are controlling it by letting them use it. And so to be clear on that, we're sending out education, it needs you know, ChatGPT, all those other, the publicly available tools need to be treated like anything else that we have publicly available. Needs to be treated like email, needs to be treated like chat, like any type of chat, like we cannot use it for PHI. And we're not, like, we're actually watching that for outbound usage. We never blocked it though internally. We want our users to use it. We want them to know how it works. And we also are providing those tools internally with our, like, whether it's Microsoft Copilot or whether some of our Epic tools or some chatbots that we're building out internally in our Azure service in Azure with our OpenAI service through Microsoft. They're using some of the same ChatGPT background. So our strategy there is to give them the tools that they can do it securely and learn how to do it without going out into the environment and doing it themselves.
Yeah.
Similar with like ambient listening technologies too. We have multiple ambient listening technologies that we're trialing and piloting, and we have some in production usage now. And you know, there's a lot of them. There's a lot of other products that are out there in the market that you can just like sign up for and use it yourself. But we want to make sure that they have it, that we have the like secure HIPAA compliant products for them to be able to use in-house as well.
So, and Chris, from your perspective, I'm sure you get 12 calls a day from vendors pitching their AI product, and
I do.
it's coming at you from every angle. How do you prioritize what investments you're going to make in AI?
Yeah, that's an interesting question. We try to partner with strategic partners. So Microsoft, Nuance is one of the largest consumers of AI or developers of AI, and they're a strategic partner of ours. So Nuance and DAX was a really easy conversation to have. You know, we get out of the woodwork, like you said. If anybody finds my name on anything, they're going to send me an email or call me. So we try to look and consolidate where we have tools existing that are developing in the AI space that we can expand on versus bringing in a whole new tool that's going to cause a whole new workflow that's going to create, more cost. Adding on to existing is a lot better for us in our perspective than buying net new and then finding that it might not be as good or isn't as good as what we could have already.
I would say too, we're fortunate to be in a place where our technology and the partners that we've chosen over the last 10 years have been very out front in this space already, whether it's been Epic or Microsoft specifically. And so we have had kind of early access or easier access to some of those tools. And that's been really positive. So, when we've had a lot of vendors that have come in and have, like you mentioned, like pitch stuff, like we take a lot of these meetings and talk to them. But for the most part, we have the ability to do most of what it's in our systems now, or it's like coming very soon. So, but a lot of it, it's learning and seeing what the ideas are. Like we're constantly looking for new use cases. So we do take a lot of these meetings just to understand, well, what are the use cases? Like what are other people using it for? How are they using it?
Yeah. So shifting gears a little bit, it's a very challenging cost environment in the healthcare space today, particularly if you're a provider. How do you guys combat that challenge with still trying to remain innovative and competitive in the marketplace?
This is my favorite conversation to have because
I thought he would take this one.
I really pride myself in the ability to shrink our budget, shrink our consumption. So, if the money that we have allocated towards IS and innovation and things like that is a bucket that we have to manage ourselves and, inside of, but, we have the versatility with our leadership that has allowed us to say, well, if you're not spending it here, you can try to find it, innovate in other ways. So, that comes with partnering with others that can, like we have an aggregator that looks at all of our old telephony and circuits and turns them off. Some of them, we never know that a clinic closes and we continue paying for the ISP for months and months and months. Or we might get a better contract or a better price if we were to negotiate a 36-month contract versus a month-to-month. So, and we know that clinic's never going to close. So, shrinking that little bit every now and then, turning servers off is my jam. I love turning things off. So not only shrinking, the costs, but shrinking the consumption where our virtual server environment is smaller. The platform is, the footprint's a lot smaller where we can spread a lot more with a lot less. So it's just really exciting to turn everything off, blow stuff up. So I really, really love doing that. And finding money where nobody else has found it before.
I think too, in healthcare, maybe more, I'm not sure about other industries, but maybe they're similar, but there is a lot of tech debt in healthcare. healthcare. There's just a lot of legacy systems.
Mhm.
We hold on to stuff because of, and sometimes it's because of just the unknown of retention or the unknown of how to keep data or what data to keep. So we keep systems around in place for a long time, and there's a lot of debt behind that, or even our own IT systems, we do the same thing with. So we've, like Chris and I both, and Chris has done a really great job with this, is when we want, like when our team or our leaders are asking for something new, it's like, yes, you can go do that, but you can't do these things. Or like, come and give me, you really want to do this, come and give me some percentage of that amount from something else that you're turning off. And since we've started having that conversation the last couple of years, it's amazing some of the responses that we got on things that we couldn't touch 3 years ago. So it's we've made a lot of changes there.
I would agree with you. So I know we talked about this a little bit with AI, but how do you guys evaluate emerging technologies?
How do we evaluate them? Does Reddit count?
Oh, I think we listen, right? We hear, we go to Epic and we find the new things that are attaching to Epic. You know, we look at, you know, the big strategic partners, the big applications that we leverage, mainly Epic being our EMR, and see how they're developing and who they're developing with, and kind of that's where we would start, I would say. And then we could expand on that further by digging a little deeper on the technology itself. To find other players that might be a little bit more open to, you know, our core.
Yeah, I would say we both kind of like, you know, a lot to add to that. You know, we also we attend a lot of different conferences, and not just like your typical like healthcare IT conferences, but like the health conference and some others that are like focused on disruption. And focused on emerging, like both of us, I think we kind of geek out on what we see out there, what's potential out there to disrupt, or what's going to change. It's just we kind of find it, I know I find it fascinating. So, you know, when it comes to generative AI or even like potentially quantum computing or nanotechnology and those types of things, I think it's hard to evaluate now because it's hard to like even assume where there would be ROI or there would be, you know, use cases for some of that is kind of emerging and coming, but it's just the idea of what it could potentially change. I find very interesting.
What conferences do you attend?
Typically, so Vive, HIMSS, Chime Fall Forum, and then I have attended the health conference, HLTH. That one I have found really interesting. It's not really an IT conference. It's more about like innovation and disruption, and probably some of the most interesting like sessions that I've been to have been there, because it's just like, there's been some that are like just really kind of far out there ideas that make sense like in the future. They might not make sense now in our current payer model or how the US healthcare model is currently built. But they're, you know, the 20 years, 30 years out, like how things could be or should be. You know, it's always kind of fascinating to see what some of these thinkers are, what they're thinking about.
So speaking of disruptors, what do you think about all of the non-healthcare companies that try to get into healthcare and disrupt the market?
I think they're doing a good job of making us move. Let's put it that way. I think we had a lot of conversations about this a couple of weeks ago with the Walmart news. But I do see in the future, and I think a lot of us do see that our future competition in the ambulatory space is not our traditional like inpatient competition that we look at now. It's gonna be like this. It could be the CVS, the Walmarts, the Amazons, the others. They have the right idea, and because we talked about this, like all these retailers want to get into healthcare because there's this huge opportunity. And the other thing that they have going on for them is that the patients want that. The patients want the big retailers to get into healthcare because they want to be consumers of it, and they want to be able to consume it that way. Payer models don't really work that way. And I think that's exactly what just happened with the Walmart news, is that they had the right people. Like they had the right people involved. Like we know some of their senior executives, like they knew what they were doing. It's not like they weren't healthcare people. It's just when you get a public company that gets the pressure to move, and like, could they invest this much money to continue Walmart Health at these low margins, or take this money and go invest it somewhere else to make 5 times the margins, they're almost always gonna go do the other thing. And we've seen like Amazon do that multiple times now with other investments, right? Now they still have one medical that they're working with, but I think that we've already seen a few others do that play a couple times. I do think for us, I think it keeps pushing us to improve our digital tools and our digital front doors and our like, and improving that patient experience, because that's what we're all worried about. We're worried about that big tech company are coming in and radically changing the digital space that we work in. But it is amazing to see how far like the industry has come in the last 4 years with the tools that we put out since the beginning of the COVID pandemic, and how much better and more, it's still not perfect. And in most cases, it's still not great, but 4 years ago, it was terrible / atrocious. And so now it's much better, and we're seeing radical improvements in those areas.
So where would you guys like to see FMOL improve in the next couple of years as it relates to digital front door patient experience?
I think more of from my perspective is, and we're doing some of this now, and there are some limitations within our patient portal with MyChart. But we're moving in the right direction, is the quote, like the MyChart for all, where it's just easier. You don't necessarily have to have an account to log in. You can pay your bill. You can do, like, prior to maybe 18 months ago, like everything was locked behind the MyChart access. I do think too, and Epic's already kind of come out with this, and I don't think they have any dates around it, but it's that identity federation across MyCharts that I think is like, makes it more difficult for users now, right? So being able to log in once and see everything that I like, for instance, in the Baton Rouge market, we have 3 major players with Epic. And if you're a female, like you have the Women's Hospital, you have Ochsner, you have FMLHS, and now you even have Baton Rouge General in their ambulatory space. So I think, being able to like log into MyChart and seeing all of that without having to go between instances would be huge improvement for users. I do think too, like in the very long, we're going to talk about really disruptive technology. I do think that's where you could see a blockchain improve to where, or like that's where you can see the real value in like a blockchain technology, where the consumer is the owner and holder of their record, and they're bringing it with them places, right? I think, well, we've already kind of seen blockchain fizzle out because of all the NPT stuff, and there's a lot less interest now, but like, I think that's where some of that technology can really, that's still like 10 plus years out, but something like that, I think would be huge for healthcare, where the patient is in control of their record. So.
As a patient, I would very much welcome a single MyChart for every health system I go to. Yep. So Chris, provider burnout is a major topic. Read headlines about it every day. What is FMOL doing, if anything, within IT to combat that?
Well, like Will said, we're reducing clicks, which is always, top of mind for providers. There's been other things that have been pretty fascinating that I've learned from providers, talking to clinicians and those other skill sets, things that I hadn't considered before, like simple things where you're a radiologist, and the amount of times you have to turn your neck to look at an image versus going to the record, like looking back and forth. It's just exhausting all day, or spinning in your chair, or things like that. So, leveraging technology where it fits on a screen, or pushing our vendors and our partners to, hey, let's shrink this and make this more optimal for them because of this. And, translating that for our clinicians and our customers to the vendors, to where they better understand the development there is important in my eyes, because we're obviously customer serving, patient centered, we're a healthcare system first. So leveraging IS to that kind of innovation is really important.
I like to say too that one of my like overarching strategies with technology is to eliminate technology. Like and that's not to say to get rid of it totally, but so that the user or the consumers aren't really aware of the usage of it, or they don't have to interact with it. Right. And I think that we're seeing some of that. We're seeing the steps towards that with the new ambient technologies. So where you can, as a clinician, just have a conversation with the patient and it's building the note in the background. And our initial users, I think we've got about probably close to 50 active users now between DAX Copilot and Suki AI that we're using between the two products. And it's most of the feedback has been very, very like overwhelmingly positive, saving time. We got a couple providers that were going way past 5 o'clock every day closing notes, and now like they're closing notes as clinic shuts down because they're just doing it actively in that conversation. So it's not it's not perfect. It's getting better though, and we're seeing the iterative changes like becoming significantly better over time. I do think too, like just if you look at technology now, like all of us as consumers, we're constantly looking at our phones. Like I don't think that's going to last forever. Because I think we all there's a danger to that, whether it's driving, whether it's walking, we're just disengaged with the world around us. And I think that's temporary. I think there's going to be I don't know what it is. I just think that there's technology will evolve to where we're going to move away from that at some point. And to where we're less engaged with the physical technology. And it's more augmented around us.
I feel like you just released an omen into the air.
Google Glass. Or something. We're all walking around with glasses.
Chris will still have his Android at school.
I will. It's all right. It'll be better too.
So a cornerstone of FMOL's mission is we seek to make a significant difference in the communities we serve through Catholic health services. How is FMOL looking at IT to help contribute to positive change in the community?
Well, some of that we do, I think from a technology perspective, some of it we're doing through our Community Connect model, right? So our Community Connect program, where we are implementing Epic or our technologies with either other ambulatory providers, or other health systems that otherwise couldn't afford it or wouldn't afford it because of the cost, and we're helping to take on some of that burden. And I think that's from a technology piece, that's one of it. We're also doing a lot of work right now in the social determinants of health space within the medical record, in helping our consumers and patients find that assistance post-visit, whether it's post-discharge or post-ambulatory visit, and connecting them with it. So we're building those interfaces and bridges with the Greater Baton Rouge Food Bank or with Uber Health or with others to get transportation, because most of the time, leaving yes, we can heal you, but the critical parts is post that, and it's at home, and it's if you get home and you don't have access to care or transportation to get back, or don't have access to transportation to get to the pharmacy. Those are the things that we're very committed to. We have a team within IS, and obviously a team within operations that is totally focused on that in our different regions.
Okay. So tough question. Many would argue that the healthcare system is broken. What if you guys could pick one thing to change about the continuum of healthcare, whether it's, master patient index, overhaul of reimbursement rates, social determinants, if you could pick one thing to change about the healthcare system as a whole, payer, provider, what would you change?
I think I would probably choose patient identity. Living in the world of interfaces and imaging and all those things, exchanging patient data is incredibly difficult. And as we continue to expand our footprint with Community Connect, it only gets more and more and more challenging with the number of systems that you have to integrate with, or you have to consume the data from, or whatever it might be. So, patient identity, and Will and I have talked a lot about some about the blockchain, as a patient identifier, and it's just so fascinating to me that it could get to that, because if you had the patient owning their own identity, it would be a lot easier for everybody to just move around and integrate together. So it's just my thoughts.
I think master patient index is one. I don't think the normal healthcare consumer has any appreciation for how difficult it is to identify. It sounds really easy on the surface. It really does. It sounds, but then when you get on the back end, like Chris mentioned, when you have multiple health systems just in the same region, all trying to share and identify patients. It is very complex and difficult, and there are a lot of errors, and like we spend a lot of time fixing and correcting those errors, and that would, obviously that'd be a big thing. I think, I'm not an expert in the payer space, but I do think I think there's just a lot of challenges based on the regulations and how we have things set up. And I think I don't have a suggestion for how to make things better. I just know that there's opportunities for improvement for sure.
So my answer is, I'll answer my own question, is put more onus on the patient. I think right now that the provider and the payers are the only ones that have a stake financially, at least, in the patient becoming more healthy. The EDs are overrun with folks that are coming in for non-emergent issues because there's no repercussions for them.
I would agree with you, but there's also contingencies these people consider that are outer that I don't have any concept of what it's like to be, that individual. So, but preventative healthcare is absolutely very, very important. If you could change one thing and re-educate the patient, from birth, right? From like first grade, this is how you take care of yourself. No longer the 4 main food groups or whatever, the pyramid or whatever it is. This is, you have to exercise so much. We see it a little bit in the commercials of my kids, at least, like Play 60 and stuff like that. But I think there could be a better effort of preventative health.
Yeah,
for sure.
And we do. I mean, I'm not telling any secrets here, but we operate in at least 2 healthy states in the nation, Mississippi. And if you look at it, it's not just it's healthcare, but if you look at the dental care in both of those states too, they're both 49th and 50th. They're like we're last in both, are in the bottom 5 for sure. And if you correlate all that data, what is it? It really goes back to education. And where these 2 states are both last or below in the bottom 5 of education. And I really think a lot of, obviously that doesn't solve everything, but like your point, I think there's a lot of education challenge with how to take care of yourself, how to take care of like dental, how to take care of healthcare. And I think that's where we have a lot of gaps.
What, are there any podcasts, newsletters, magazines, etc. that you guys subscribe to, or how do you guys get updates on the healthcare industry and just technology industry as a whole?
Read a lot of Becker's. I also listen to Father Mike Schmidt, which is a podcast, Catholic priest. It's pretty good. And Joe Rogan. He's legit. A little bit of paranoia, but that's healthy for anybody. I don't know what else.
Obviously Becker's is really good for like snippets of news that you can go and dig into somewhere else, right? It's nothing sometimes, but they've got there's a lot of good, they're a great aggregator of healthcare information. And there's a lot of great Becker's podcasts and like their different media that they put out. As I struggle with like the industry podcasts. I don't know what it is. I think like, especially if I'm on like a multiple hour drive, it feel like it makes me snooze a little bit. But so I do listen to a lot of like entertainment podcasts, specifically like the Bill Simmons podcast. I listen to a lot of stuff, mostly sports, entertainment, and Star Wars.
Star Wars. Dropped that bomb on us.
I will say that Reddit does have a health IT thread that I just started looking and reading about, and it's pretty fascinating to read.
Interesting stuff.
Yeah.
I'll have to check it out.
Yeah.
All right. Well, thank y'all so much for your time today. Appreciate it. And till next time.
Yeah, sounds great.
Thanks, Sydney.